your stress levels are going up, and if your stress levels are going up, certain markers are changing. Or if you're not exercising or your diet changes, what is impacting what markers in which direction? And then the onset, some of these start giving you early indicators. If you track them over 3 or 4 tests, you will see trends, and trends become very, very valuable.
How are you going to live long? That means you need to understand that if you want to live long, what is going wrong in your body?
That closed loop learning model is where we're going to break through with answers, because you start seeing amazing ways in which you can make improvements, which you could not earlier because everything was anecdotal. Even when you do precision recommendation.
At least the aspiration here for all of us in the longevity space is that I think we are going to be very soon at the cusp of where all these ability to very in a low friction manner measure, right? Derive the right biomarkers and track them dynamically.
I think with longevity, we have the opportunity to using technology to truly leapfrog, because it's a new area that's emerging all over the world. We have ancient science and we have modern smarts. And if we combine these things, I think we can really leapfrog.
Hello, this is Prashanth Prakash, founding partner Accel. Welcome to the Biopeak podcast, brought to you by Longevity India, where we discuss in depth all issues related to longevity in India. In our studio today, we have two experts who have, in their own way, spent a decade in this space. I have Dr. Deepak Saini, who is a professor in biological sciences and bioengineering at the Indian Institute of Science here in Bangalore. And I have Rajesh Reddy, an old friend, who's been an investor in this space for some time and now starting to spend more time with one of the startups, Serotonin, based out of the Bay Area. So welcome, folks. Yeah. So this is going to be an interesting one. Technology disruptions are always interesting to talk about. Rajesh, you have spent a lot of time looking at technology, evolution of technology in the longevity space, right? As an investor, as somebody who's also practiced some of this yourself. So you've, this whole area of medicine 3.0 and how it has emerged. So maybe just lay that context to all of us.
Yeah. Thanks, Prashant. I think so. One is the backdrop of all of this is a mega trend. That is the move from what is considered the traditional form of medicine currently, which is a medicine 2.0, yes, which is mostly pharmaceutical interventions. It's after disease is onset and done through the current system of both the pharmacology and the medical system, versus what is contrasted now as a medicine 3.0, which is preventative, and basically where you are going to root causes and looking at the whole body and figuring out methods to prevent the onset of disease. And the models used in this are quite different from how people approached the medicine 2.0, and that's where the realm of scientists, technology play a big role in this area. And I think the way the technology platforms have evolved to address this is we see it in 3 generations. The generation 1 technology platforms were solving for diets. And as we know, in our early days of building our first companies, we've seen companies that do diet-based platforms, like the South Beach diet was a famous one in the mid-90s and 2000. And then came the generation 2, which is weight loss platforms, fitness apps, and specific solutions around things like diabetes. And you'll see companies who built very good solutions using technology as a framework to solve for successful outcomes and results in these areas. But the exciting part that we are seeing is what we call the Gen 3, the 3rd generation. And I think this is where you are looking at how we can solve for the full potential of preventive health and aging and health span using a lot more sophisticated tools. So here you're looking at multimodal interventions. You're using a combination of diet, lifestyle, exercise type, fasting, supplements, and other methods and mechanisms in combination. And when we do that and apply through levels of hyper-personalization, where you're able to get a range of different measurements and biomarkers on which you can then make decisions. And so you have consumer tests for blood and for lab tests and genetic tests and wearable data coming in at an enormous amount of granularity, combined with ability for IoT and other measurements that can measure your behavior, and with generative AI where you can even capture
you
your
can
diet.
interrogate your own data.
And no, this is just the input data. As we're getting the ability to measure, so track everything, then you're getting this kind of rich ability to then profile the user and then apply the right interventions. And so that's kind of where it's a realm of software. So now you're coming to, we are looking at platforms already with 1 million parameters per person within 6 months. And if you want to apply anything to make decisions on top of it, you will need software to help you do that. And so I think that is the framework that's emerging, is basically these elements of technology. And of course, on the back end, you have the whole ML machine learning frameworks to make sense of the data and then apply it back. And so this is the exciting part. I think we're seeing that's what we're calling the Generation 3 technology frameworks.
So most of these longevity clinics in the US and some of these membership-based programs, I think are very focused on screening, right? Usually image screening, and so that's the kind of the primary mode of detection, and which has its place. It's very useful, right? So because you'll never know if you have a pathology that is developing, and unless you do a full body MRI and so on. But I think the downstream aspect of managing that, I think, is what is lacking in most of these programs. They don't have a platform, basically.
Absolutely. You said it very well. I think the first step is knowing, and I'm glad that we have now
all kinds of screening that you can
do. And because knowing was the first challenge, and knowing at a cost-effective way, and being able to frequently test, which is also an important thing. It's not once and done. Your body is constantly changing. You need to have frequent testing.
And how frequent is that frequent?
So it depends. And I think this is a really interesting topic. It depends on the type of test. And so today, if you look at your kind of full body, your lab tests, the blood tests that you do, which is annual tests.
So maybe quarterly, you would probably do that?
So we think, based on the nature of and what you're seeking, it would be great to have data every 90 days. It would be great, because you can see trends, progression, and you can correlate that with other things that you have done. So you
which have started to change, right?
Absolutely.
And then double down on things that are...
Absolutely. And you see which are correlating. Of course, causality is the next level, but even the correlations, knowing that if you do these things, your stress levels are going up. And if your stress levels are going up, certain markers are changing. Or if you're not exercising, or your diet changes, what is impacting what markers in which direction? And then the onset. Some of these start giving you early indicators. If you track them over 3 or 4 tests, you will see trends. And trends become very, very valuable. Then data is one off.
So Deepak, one more central dogma for you question. So this area of multiomics, which is central to systems biology and precision medicine, and what you can get out of looking under the hood and going beyond blood chemistry and looking at your
unbiased data,
your metagenome, looking at your metabolites and so on. Do you see that becoming more practical, and that approach to precision medicine accentuated by the ability to use these bioinformatic pipelines and then AI and ML to then look at pathways dysfunction and so on?
I think the shortest possible answer to your question is yes.
Yes, but where are we in India?
I'll tell you what exactly. That's interesting.
3 years away, 2 years away, you think we can start tomorrow?
That's the interesting bit, as you rightly mentioned.
And maybe you want to kind of, I've given maybe a little bit of a layman thing. Maybe you can accentuate it.
I will give you the granularity of the problem which we're dealing with respect to aging. A lot of things which Rajesh mentioned about ability to record. When you say record, the question arises is, what are we recording? And that's a fundamental root or the driver of our modern medicine. And I'll give a very interesting context to this. I mean, India is one country where we actually use a form of greeting. We say Ayushman Bhava. Right. We actually say that, which basically, may you live long. Yeah. The word, I think we need to emphasize the word may. How are you going to live long? That means we need to understand that if you want to live long, what is going wrong in your body?
Right.
We had an ancient culture of looking at nadi and everything else. That culture was very empirical. Very empirical means if you happen to be good in those sensing,
Yes.
you
have
get
be
to take the right decision. But the good is a very relative word. You can actually get a good person to sense, otherwise a bad person to sense. And that sensing is at the heart of most of our decision making. When you say sensing, how much data do we need to say whether you're healthy or not healthy? Classic modern medicine is actually relied on markers, which is now slowly increasing penetrance because of ease of technology development. We are actually coming with so many sensitive platforms that we don't need devices or need a specialized lab to collect data. Previously, getting an ECG done actually required you to go to a clinic and lying around with all the electrodes stuck onto you, and you get a recording which nobody understood, and one person looks at it and say, what's wrong? Now the same thing your watch can do. So that means there is an ease of deployment which we are facing as the technologies become progressive.
Rajesh was saying, if something has to be done every 90 days,
Absolutely.
it cannot be very cumbersome.
So we are slowly maturing to reaching out to markers which were previously considered not necessary, previously considered not important because one, they were individual wise, they're not very compliant. They were not really comfortable. I don't want to get a blood draw every 3 months. Can I do it non-invasively? I think a lot of technology has moved into those sectors where we can get recording of a lot of molecules non-invasively. But coming back to your point again, what information are we collecting? We are still collecting markers, indicators, which are classically linked to sickness. We're still trying to measure things which say, are we sick or not? We're still not measuring whether you're healthy or not. And that's where we need to revisit our drawing board to collect as much of diverse data set as possible, as you said about gut.
Yeah, starting with the function
Start
of the
with
gut.
we need to take an unbiased, unconstrained, medically, from a medical history, unconstrained with the medical history of an individual, a granular data, as much data as a technology as it stands today allows me to collect. So if I collect blood, what all can I learn from your blood? Because blood is an invasive media, but blood is one media which collects every part of my body. Blood is a very good indicator of what's going on or not with my body.
Deepak, just to kind of clarify here, with the same blood, you can do your traditional blood chemistry and you can do the discovery which have very, very new capabilities.
Yeah. So, for example, I would say that this is what we are doing under Longevity India is we are collecting details of each individual by using this highly granular analysis for all different ages to see
700 odd parameters, right?
I would say not 700, I would say close to 1 million odd parameter right now, because we are trying to subject each individual to that many different granularity to see where all things, so it could be epigenetics, genetics, genome, proteome, metabolome, metagenome, which is in the gut, biophysical changes. We have no idea where the change with age is going to come out from. Now, why we are doing all this is very simple. If you actually record change, which is occurring in a healthy aging individual, I don't need intervention for that aspect because a part of healthy, but a deviation from that is a node for intervention. So while such technology-driven exercises will give us idea about healthy aging, it is also going to give us idea of early biomarker detection onto which the future sensing technologies could be developed on. So it's an integrative exercise. We learn as we collect data and we deploy to increase patient compliance or individual compliance. And that's where we think the next big shift from therapeutic treatment to prevention will occur.
Prevention, and I think you also can be a little bit more targeted on where those processes have set in, right? Which organ?
Yes. So as I said, it's an organ-specific viewpoint we'll end up obtaining. And if you have an organ-specific view, you have an organ-specific window and individual.
Look at,
it's easy to deploy supplement. It's easy to deploy therapeutic interventions. So it actually is all converging into one aspect, that how much do I understand you or me as an individual. Hyper-personalization is going to be the norm for future.
Yeah. So this is kind of the next level of the last podcast. We had the genome to the phenome, and now we are kind of saying that the next level of that with technology is hyper-personalization.
And deploying the phenomic information using sensors.
Leveraging that and leveraging your current biological state, layering those two and then deriving. So that's kind of the dynamic aspect of the system, right, Rajesh?
Absolutely.
That there's a very dynamic system.
Yeah.
And how do you use the longitudinal dynamic nature of what's happening in my biological system to then influence me and use AI then for pushing me in the right direction with the right nudges and so on.
Yeah, I think that's kind of the interesting part, is that one is the hyper-personalization to know everything about a person. But the fact that that person is not static, and every day there's a day in the life of real life of people. And I think getting to know what's happening in real life, including the way the individual is adhering to the protocols recommended, because without which you would not know what is causing the change in metrics when you do the next measurement cycles. And that part we found was a really important problem to solve, is like knowing what the user individual is doing to help them better understand what is causing the next round of tests to manifest a certain way. And so getting into that process was a key element of it. And there, it's because every day in the life is different. And knowing what exactly they're adhering to, and they're adhering to sleep and exercise type, specifically what is anecdotal information could never help us get there. Similarly, anecdotally with nutrients, the biggest challenge with getting precision from any of these would be because of lack of real data of adherence and consumption. And so hence most systems became comfortable with doing it in more broad brush generic ways. So to apply this as a sharp weapon, we needed to get that daily behavior data. And I think that was a key part where technology really helps. But to make it work, I think there was another significant challenge to make the dynamism work, is the user behavior. And there's two parts. To be able to apply the daily change, to apply to a user how to consume these things and be able to track that, but also motivate them to follow it and then measure what actually happens. And then
because
use
it's
that.
not just consumption, right? It's your 3-to-1 exercise.
It's exercise
protocol.
types,
I mean,
type of sleep,
of,
fasting, and also the cycles in which you do it. Because many of these are not things you do every day. The things you do every 15 days or every once a week. So how do you cycle between these things? So so on the side of the user being motivated to do it is one, and then what you learn from that and then apply dynamically to change the protocols for the user. Yes. So there's two sides of dynamism. So the first part is interesting enough, motivating the users, as we all know, and I think we were just talking earlier about scientists doing longevity. Are they the most healthiest in longevity because they're working so hard in the night and they're doing stuff that that is making, and it's true for entrepreneurs.
Some of them are like Deepak.
The exceptions, like Deepak, but entrepreneurs doing longevity too. I think the challenge in real life, everyday life, I think
most
comes to the
entrepreneurs
fore.
seem to get to longevity once they're done with their startup.
That's the last start, the latest startups when you move to longevity.
So we also have a thing in scientist domain. They said every scientist thinks about working on longevity when they start hitting 50. Yeah. Before that, we do everything else.
With some exceptions.
Yeah.
But so I think the whole model here is that there is a protocol recommended, and then there's an ability, and do it in a way it's actionable for users so they can follow it, motivate them to do it, track actually what they're doing, and then measure the next test, see the data, and then flow it back to improve. That closed loop learning model is where we're going to break through with answers, because you'll start seeing amazing ways in which you can make improvements, which you could not earlier because everything was anecdotal. Even when you do precision recommendations, it stops there. And then you don't know how the precision is being applied and followed.
Adhered to, yeah.
Absolutely, adhered to, right? So we found that the first part is motivated by human behavior. Human behavior needs goals, needs gamification, needs rewards, needs pat on the back. And so we found that that's where each of these are rewarded. You reward for good behavior in sleep, you reward for good behavior in type of exercise, and you reward for good behavior in supplementation. So each of these get rewards, but they're combined into a score, and people follow that, they do that. Second is social gratification, because I don't want to do it alone in the closet. I also want people to acknowledge me, and then I want to see other people having good behavior influence my behavior. Right. So we found the social components come in very helpful and handy. So that's all in the first part. But interesting, in the second part, now how do we use that data as we know that people are doing these things and adhering to this? Because using that information, you can fine tune these protocols, because it's important that these things are not things you do every day. Like if you do intensive exercise, then your protein requirements would be high, and having a protein right after that will give you the best benefits, because if you want to do that. So that's an example of or if you're using, for example, protocols like autophagy fasting. You don't do that every day. I mean, you cannot do that kind of, as when you do that, you could do specific activities to boost it, but don't do growth related, mTOR related heavy exercise and protein on those days, because you're countering the benefits of autophagy. So giving people ways to actually see what they're doing and give them dynamic advice is things that will help. And so I think all of this is where technology becomes very exciting.
Rajesh, what we have seen is, as a country, we have always leapfrogged, right? Whether it was mobile phone, whether it was our digital payment ecosystem. So at least the aspiration here for all of us in the longevity space is that I think we are going to be very soon at the cusp of where all these ability to very in a low friction manner measure, right? Derive the right biomarkers and track them dynamically, and then make interventions from them, and then iterate on that. I think this whole paradigm, I feel, is we are kind of ready for it in India. Absolutely. And I think this can be one of those things that Deepak hopefully reverses that slide we are in.
So, Prashanth, coming to this is a very interesting point, something which you like to say. It's systems engineering.
Yes.
It is completely systems
This is
engineering.
full systems
So
engineering.
where the input decides the output and output decides what the next input is going to be.
It's the whole
so it's a
system,
cyclic
yes.
argument. So the point is, when you say, are we going to slide down? I think we are going to slide down. Aging is inevitable. The slope is going to change. And that's where I think we should focus on, that how shallow or how steep our slope is going to be. So it needs a continuous systems, sensing, decision-making.
It's almost like Deepak, I'm saying a little bit, can we bring it back? I think we were maybe always here,
Yes.
right? We discussed in the first podcast about our moderate habits and
Yes,
so on.
yes.
Then we are already
Going down.
here now.
Yes.
So can we
we
pull
take
back?
it up? Yeah, of course. The slope should change. And that's what the intent of the complete longevity landscape should be. Can we shift the slope such that the duration an individual spends in a fitter state is bigger?
Right.
I mean, and also it's more rewarding. It's more gratifying. If you are dignified when you're getting old, it is definitely going to increase or quotient of happiness.
And AI as a technology is becoming more and more affordable and democratized. So I don't see a reason why 2 to 3 years from today, we could be on par or be leading this whole revolution to imbibe and adopt some of these technologies.
Absolutely.
The leapfrog you just mentioned, I think, really, Prashanth, is that exactly the way we happen in mobile phones, which I think all of us saw the internet and mobile phone era when nobody believed it's going to be such a leapfrog that we saw it, because landlines we didn't have. We directly leapfrogged mobile, and with payments, we're just seeing it as we watch becoming the biggest in the industry. I think with longevity, we have the opportunity to using technology to truly leapfrog, because it's a new area that's emerging all over the world. We have ancient science and we have modern smarts. And if we combine these things, I think we can really leapfrog and be big optimists.
Deepak, that's really what we really need to achieve in India, right? So, and you always talk about it. It is something different for our context.
Yes.
And that context is leveraging ancient wisdom and leveraging all the good AI and disruptive technologies and bringing them together and making them work with a very open mind.
Yes. So I think you've touched pretty much a raw nerve here, that it says that why we do not have centenarians, which is what we started with to begin with.
Yeah, in the first podcast,
we talked about why are the
centenarians?
centenarians, and we now, over the full cycle, we know that they're not going to just appear overnight. And given that ancient wisdom exists, there is a reluctance because of lack of understanding about us. Right. Given aging is so personal, so ingrained to each one of us in a very different form, each individual will actually give a different answer to aging, because it could be If you're fitter, it could be something to look forward to. But if you're not fit, it is something which you do not want to look forward to. That aspect, bring in with technology, to bring in with the traditional knowledge, would actually be the way we can change the slope of this aging curve. But yes, India is going to stare at a very large number of aging people. And this really needs much more global approach with the traditional mindset to allow us to come up with right kind of solution which is needed in this area.
So, Deepak, do you believe that the traditional health systems, in some way, in India, have been a bit more adaptive compared to even in the West? I mean, there's a little bit more, nimbleness in our health system here. Do you think that very soon we will have these clinics in India which will deal with this systems engineering approach that we talk about, will incorporate all the integrative multimodal technologies that Rajesh spoke about? If you were to guess, are we saying we'll be there in 12 months, 24 months? What's your view?
I think,
Rajesh will ask you the same question.
I think it's already started in India. It's already there. In silos, definitely on the big cities, it's very much there. And the spread is slowly increasing. People are becoming more conscious, be it because of the mobile revolution where you can access information very easily. But I think it's more largely driven by a very unique process. And if I can say that, it's something which I read somewhere. It's largely driven by the idiot syndrome, which is the internet-derived information obstructing treatment, which is what clinicians like to. But what is actually happening now? A lot of people, because of this information or hyper-information, are not satisfied with the current medical intervention which has been offered to them. Correct. That dissatisfaction is what actually allowing them to figure out what is wrong with me or I, and that will allow them to explore alternate or holistic view of healing. So it is going to happen.
And Rajesh, we have, as a country, always had entrepreneurs who quickly sense these opportunities. I mean, when Aadhaar and the India Stack happened, you had thousands of startups and entrepreneurs who went after it and created great user-facing products that made this all very usable, right? So my own perception is that sitting here maybe 2 years, 3 years, we'll be just amazed at the number of startups in India that will be tackling this problem.
Absolutely. And the two, I think, things here, one is looking at it as an entrepreneur and looking at it as a user. I feel looking at it as a user of all these capabilities, that's our generation. We actually have a absolutely solid basis to expect it to be peak or good health span until 90. And I'm being a bit pragmatic here and not saying 100, because based on the data that we have and the tools we have at our disposal and our willingness to follow these things, if we connect all these dots, I think we have a good chance of having solid 90 years of health span as part of this generation of, and the entrepreneurs will enable it.
So we are going from in India 75, Deepak, where are we now? 75 to 90 is what.
Yes, but with peak, with the health span.
Yeah, I know.
So
but
as much as lifespan,
yeah.
health span of 90.
Don't do it. Just keep people in hospital. Yeah.
Exactly. So I think that is a very, very exciting opportunity for, I think, our generation.
So Deepak, there's a lot of startup entrepreneurs, right, who will be watching this program. So I want you to kind of also give the broad areas in which you see some of these disruptions, whether it's wellness, therapeutics. So, we just coming hot off the press of a conclave. So we saw some very interesting startups. So maybe just few thoughts on where you believe, other than we have spoken about the clinics, we have spoken about some of these, personal, companion, multimodal products like what Rajesh spoke about. What are the other areas that you're seeing startups work on? So I think either to support this ecosystem or independent.
I think that largely, the way I perceive this ecosystem is, we have always been catering to sick people. And that is because they dominated the landscape. There are enough sick people. Now we're trying to think about what can I do to keep the sick people out of hospital. So that means we have all the tools at our disposal. We just need to repurpose them. Whether it is biomarker discovery, looking for sensing.
Like you also have these small molecules being repurposed. Right?
Yes, it's going to be that dominant. So we have sensing, figuring out how fit, healthy, or unfit, unhealthy I am. Second aspect, going by your pyramid, actually, this is something which you said, going by how fit I am. Then second aspect would be, do I need supplements?
Correct.
If I need
Then there are
supplements, are they
opportunities.
in the toxic range or in the right regime? So it will still be therapeutics and intervention. And one market would be, which may end up dominating everybody, would be the lifestyle, which would encompass everything together. What are we going to do to keep old people happier, healthier, and also contributing to the society? There's going to be a very fantastic market around that belt, which will integrate everybody into them.
This kind of summarizes very well where we started of the perception of aging in India, changing that perception as a point in life where you kind of just go into the wilderness and do nothing, right? And accept frailty and accept whatever, the
fatality of it.
The degradations that could happen. And you're saying that from the younger generation and from the startups kind of fueling some of this and making these technologies more accessible, like what Serotonin is doing, you will see the opportunity now for a lot more people to extend that health span.
Yes.
And hopefully also the biomarker discoveries.
Yes.
So I'm kind of summarizing everything.
Absolutely.
Since this is our third and final podcast.
Yes.
So we have kind of in this, over the 3 podcasts, spoken about aging in India and the rapid rise in aging population.
Yes.
We are no longer a young only country, so very soon we will have to deal with this burgeoning aged population, and can we be proactive there? And that's the idea of Longevity India. And then we spoke about global perceptions and what we can see as relevant and what we need to do new studies on. And I think we spoke extensively on the need for new studies. So if somebody is watching this podcast and wants to support Longevity India to do more studies, I think they should contact Deepak, right? Mm-hmm. And then third, we looked at, this whole pyramid, right? And how startups will address this pyramid and look at and in various forms. And the end result is India will have more health span.
More healthy people.
More healthy people
Yes.
with better health span over the next, hopefully, decade or 2.
Yes.
So thank you. This has been amazing. All the very interesting personal experiences from both of you, and look forward to doing maybe one more. I think people will have enough of us from these 3, but at some point we'll pick this up again.
Right.
Thank you so much.
Prashanth.
Thank you, Prashanth.